So let's bring in this U.S. Surgeon General, Dr. Vivek Murthy. Dr. Murthy, thank you so much. I'm hoping that we can try to simplify this. There's talk about the administration being on defense, about reversals of policies. Dr. Fauci said today this is just a change in what we have learned about the virus. But the CDC now has this new map of hotspots. And some of these hotspots are areas with very high vaccination rates. So what level of concern should vaccinated people have feeling right now? It's hard to figure out. We're seeing a sea of red and orange, and it looks all very concerning.
Well, Andrea, I can certainly understand how people may be concerned on a day like this. You know, we've heard about new guidance, and you look at the map and you see the numbers and hear about more cases. But let me tell you about a couple of things that have not changed. What has not changed is that the vaccines that we have are still extraordinarily effective at saving lives and preventing severe illness. That is good news, and it represents progress that we've made in the last 6 months, and we're not losing that progress. What has changed, though, Andrea, is Delta, and what we learned in recent days about the Delta variant. We know that that variant is highly transmissible, the most transmissible we've seen to date. We know that cases have more than quadrupled in recent weeks. But what we learned in recent days, Andrea, was that people who experience breakthrough infections with Delta are actually more able to transmit the infection to others compared to people who had breakthrough infections with other versions of COVID-19, like the Alpha variant. And it is that last piece in particular that was a really important linchpin here in the recommendations the CDC made yesterday. I know, we don't want to go back to wearing masks again, but these masks are a layer of protection that will help us prevent spread at a time where we are seeing cases rise.
And it's transmissible from a vaccinated person in a breakthrough case to a similarly vaccinated person who may be more challenged, elderly, have a problem with immunity.
So the people that we're most concerned about are the unvaccinated. For example, if you happen to have a lot of interaction with folks who are unvaccinated, let's say you're a parent like me who has young children at home who are not vaccinated, that's a circumstance where being extra cautious and wearing that mask, even if you're fully vaccinated, wearing it outside when you're in indoor public locations is an extra step to protecting those at home. I want to emphasize, though, that if you are vaccinated, the likelihood of having a breakthrough infection is still low because, again, the vaccines are working to help prevent infection, particularly serious infection. But in the unusual event that a breakthrough does happen, we know transmission can take place. So that's why, especially when you have a lot of virus circulating in the community, it's important to take that extra step, go that extra mile, wear that mask in indoor settings outside the house so you don't contribute to transmission.
And in terms of people's vulnerability, should parents now begin wearing masks with their unvaccinated children, their younger children, at home?
Well, if you follow the CDC recommendations, what they are advising, especially for people like parents who have those who are unvaccinated at home, is to be vigilant about wearing masks in indoor settings outside the house so that you don't have to wear masks in the house with your children. I'll tell you, as a parent, that's something that I do. I happen to be spending a lot of time in an area that has a high degree of transmission. So when I go outside to the grocery store or to other indoor places outside my house, I wear a mask. And so when I come home with my children, I don't have to wear a mask because I am more confident that I'm not exposed, my children are at lower risk. So that's the approach that I take. I know that many parents out there take. And finally, I just want to say that as far as schools are concerned, and as a parent who's got 2 kids who are going to be going to school in the fall, I just want to emphasize that the layers of precaution that the CDC articulated a couple of weeks ago that are important for schools are even more important now. Making sure that our kids are masked regardless of their vaccination status, making sure that we are improving ventilation in classrooms, keeping kids home when they're sick, using testing as a way to screen out any potential infections. These layers matter, and implementing them is a key part of how we're going to protect our kids and keep them in school.
Today, Pfizer released new data saying that a booster shot would be exponentially better at neutralizing the Delta variant. So how soon do you think that fully vaccinated individuals should think about boosters? How soon would you take more seriously the possibility of using the booster? as a way of providing extra protection against this Delta variant?
Well, Andrea, the topic of boosters is a really important one that we've been very focused on, especially in recent months. What we're going to use to determine whether a booster is needed is actually data from a variety of sources. What Pfizer provided, data from the company itself, is one source, but it's not the only source. We are also following cohorts or groups of individuals in various settings, nursing homes, medical professionals, and others, to see if there is a decline in immunity and an increase in breakthrough rates. And if there is, as soon as we see that, we will make a recommendation on boosters. And the good news is we will have the supply available to provide that to the public. But at this point, based on the data that we've seen, the collective data, the recommendation is not to have boosters implemented so far. But if that changes, and when that changes, we will absolutely let the public know.
And how much do you think all of this, the new recommendations, going back to more mask use, how much do you think this is going to hurt the vaccination effort? Because one of the great appeals that the White House was putting forth 2 months ago was, you're free. If you get vaccinated, you don't have to wear masks. You don't have to worry as much.
Well, Andrea, I do think it's a really important question, because what we have learned and what has not changed in this entire effort is that the vaccines are still the linchpin of our effort to end this pandemic. They save lives, they reduce severe disease extraordinarily successfully, and they reduce the likelihood that you will get sick and transmit the virus to others. So those are all the same reasons that were true yesterday and true today as to why people should get vaccinated as soon as possible. I recognize that the mask is an inconvenience that we'd all rather just get rid of. But what yesterday's announcement doesn't do is it doesn't erase the extraordinary progress we've made. And this extra layer of protection with the mask is just going to help us reduce the spread of Delta, which again is an extraordinarily contagious version. But the bottom line is we are safer today than we were last year because we can get vaccinated. That's why we still need people to get vaccinated. More than 500,000 people are making that choice every day. And we need those who are vaccinated to talk to their family and friends, urge them to get the protection of the vaccine as well.
And do you see any change in the trend lines? Is it beginning to level off or turn back up again in terms of vaccination rates?
Yeah, I'm glad you asked. The good news is, one of the silver linings is, in the areas of the country, Andrea, that have been hardest hit by Delta, we are actually seeing the pace of vaccinations increase. In fact, they're outpacing the national average. And I think that's in part because many people are seeing what's happening in their communities and are recognizing Delta is different. It's more transmissible, and it's hitting more people in our communities. So we've got to get vaccinated. We've just got to continue to press forward and make sure those rates continue to go up. The faster they do, the more we'll be able to get back to our way of life, to save lives, and ultimately get rid of our masks as well.